Hello everyone, welcome back. This tutorial is about the anatomy of muscles of posterior compartment of forearm. So we will go through the muscles of posterior compartment of forearm in a similar pattern to our previous tutorial in which we talked about the muscles of anterior compartment of forearm. So there are 10 muscles in the posterior compartment of forearm and these muscles are grouped into two layers, a superficial layer and a deep layer of muscles. And each of these layers consists of 5 muscles. So the muscles of superficial layer are the extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, and the anconeus muscle. And in order to show you the deep layer of muscles, I will remove the superficial layer. So I have removed the superficial layer of muscles and the muscles that you can see are the deep layer of muscles. So the deep layer of muscles consists of these muscles, that is the supinator muscle, the abductor pollicis longus muscle, the extensor pollicis brevis, the extensor pollicis longus, and the extensor indicis muscle. So for the muscles of posterior compartment of forearm, you need to note two important points. The first point you need to note is that all of the muscles of superficial layer of posterior compartment of forearm have got their origin from the lateral epicondyle of the humerus. And the second point you need to note is that all of the muscles of posterior compartment of forearm except the anconeus muscle have got their nerve supply from the deep branch of radial nerve. So we are not going to discuss the innervation of each of these muscles individually, rather we will discuss the innervation of posterior compartment of forearm together for all of these muscles at the end of our tutorial. And another thing that you need to note down is that I will discuss the muscles of both of these layers in a lateral to medial fashion. So first I will discuss the lateral muscles and then I will go towards the medial muscles. So let's start discussing these muscles. So starting off with the superficial layer of muscles, and the first muscle that we are going to discuss is the extensor carpi radialis brevis muscle. So as we discussed a bit earlier that all of the muscles of superficial layer of posterior forearm have got their origin through the common extensor tendon from the lateral epicondyle of the humerus. So as the extensor carpi radialis brevis muscle is a superficial muscle of posterior forearm, so it has got its origin through the common extensor tendon from the lateral epicondyle of the humerus. And then after origin, this muscle runs down over the lateral aspect of forearm, and at the distal forearm, this muscle forms this muscle tendon, and this tendon then crosses the wrist joint to enter the hand. And in the hand, this muscle tendon of extensor carpi radialis brevis inserts onto the posterior aspect of base of third metacarpal bone, as you can see. So now talking about the actions of this muscle. So this muscle performs two important actions. So the first action is obvious from the word extensor in the name of this muscle, which means that this muscle is an extensor and so it extends the hand at the wrist joint. And the second action of this muscle is the wrist abduction, which means that this muscle acts to abduct the hand at the wrist joint. Now moving medially towards the second muscle of superficial layer, which is the extensor digitorum muscle. So we already know about the origin of this muscle, and that is through the common extensor tendon from the lateral epicondyle of the humerus. And after origin, this muscle forms this bulky muscle belly which runs down over the posterior aspect of forearm, and at the distal forearm, this muscle belly forms these 4 muscle tendons, and these tendons then cross the wrist joint to enter the hand. And in the hand, these tendons travel inferiorly to insert onto the dorsal aspects of bases of middle, and distal phalanges of medial four fingers. That is the index, the middle, the ring, and the little fingers. So, moving towards the actions of this muscle. So, this muscle performs three important actions. The first action of this muscle is obvious from the name of this muscle, extensor digitorum, which means that this muscle extends the digits, that is the fingers, at the metacarpophalangeal and proximal and distal interphalangeal joints. And the second action of this muscle is the finger abduction, which means that this muscle moves the medial four fingers away from the midline. And the third action of this muscle is the wrist extension. So, in order to understand this action, you need to focus on the tendons of insertion of this muscle. So, these tendons cross the wrist joint and will probably act on the wrist joint to extend the hand at this joint. Okay, so having covered the first two superficial muscles of posterior forearm, we will now move towards the third muscle, and that's the extensor digiti minimi muscle. So just like its fellow superficial muscles of posterior forearm, this muscle originates through the common extensor tendon from the lateral epicondyle of the humerus. And then after origin, this muscle runs down along the posterior aspect of forearm, then runs medially and then crosses the wrist joint. And after crossing the wrist joint, the tendon of this muscle moves towards the little finger, and there it inserts onto the extensor expansion of little finger, as you can see. So if we talk about the actions of the extensor digiti minimi muscle, so this muscle has got a single important action, and that's the extension of the little finger. And this muscle performs this action by acting on the metacarpophalangeal joint of the little finger. This model is showing the extension of the index finger along with the little finger. But you should note down that this muscle has nothing to do with the index finger, and it just plays its role in extending the little finger at the metacarpophalangeal joint. Okay, so now moving further medially towards the fourth superficial muscle of posterior forearm, and that's the extensor carpi ulnaris muscle. So exactly the same as other superficial muscles of posterior forearm, this muscle has got its origin through the common extensor tendon from the lateral epicondyle of the humerus. And after origin, it spirals down towards the medial aspect of posterior forearm, and at the distal forearm, it forms a muscle tendon, and that muscle tendon crosses the wrist joint. And just after crossing the wrist joint, this tendon immediately inserts onto the posterior aspect of base of fifth metacarpal bone, as you can see. So if we move towards the actions of this muscle, so this muscle performs two important actions. The first action of this muscle is the extension of the hand at the wrist joint, and that action is obvious from the name of this muscle. So as this muscle is an extensor, so it extends the hand at the wrist joint. And the second action of this muscle is due to its insertion point. So as the tendon of this muscle inserts onto the medial aspect of hand, so it acts to adduct the hand at the wrist joint. And now we will move towards the fifth and the last muscle of the superficial layer of posterior forearm, and that's the anconeus muscle. So this is a very short and simple muscle, and it has got the same origin as the other superficial muscles of posterior forearm, and so it originates through the common extensor tendon from the lateral epicondyle of the humerus. And then after origin, the muscle fibers of this muscle run inferolaterally to insert onto the lateral aspect of olecranon process of ulna, as you can see. So talking about the action of this muscle, so unlike the other superficial muscles of posterior forearm, the anconeus muscle acts at the elbow joint, and it acts with the other extensors of elbow joint to extend the forearm at the elbow joint. So with that, we have covered the superficial muscles of posterior forearm, and now we will move towards the deep layer of muscles of posterior forearm. So the first and the most lateral of these muscles is this muscle, which is the supinator muscle. So let's start our discussion of the deep muscles of posterior forearm with the origin, insertion, and actions of this muscle. Okay, so the supinator muscle has got its origin from the lateral epicondyle of the humerus, the annular ligament of the proximal radioulnar joint, and the supinator crest of ulna. And then after origin, it spirals medially around the neck of radius to insert onto the neck and shaft of radius bone, as you can see. Okay, so if we move towards the actions performed by this muscle, so the supinator muscle performs a single important action, which is the supination of forearm. So this muscle supinates the forearm at the proximal and distal radioulnar joints. So now moving medially towards the second muscle of deep layer of posterior forearm, that is the abductor pollicis longus muscle. So the abductor pollicis longus muscle has got its origin from the posterior surface of shafts of radius and ulna, as you can see. And after origin, the muscle belly of this muscle runs down inferolaterally towards the distal forearm, and at the distal lateral aspect of forearm, it forms a muscle tendon, and that muscle tendon crosses the wrist joint to enter the hand. And on entering the hand, this tendon inserts onto the posterior aspect of base of first metacarpal bone, as you can see. Okay, so let's discuss the actions performed by this muscle. So this muscle performs two important actions. The first action of this muscle is the abduction of the thumb at the carpometacarpal joint. So this muscle acts on the carpometacarpal joint and it abducts the thumb at this joint. And the second action of this muscle is the thumb extension at the carpometacarpal joint. So for this action, it acts on the carpometacarpal joint and extends the thumb at this joint. Okay, so moving further medial towards the third muscle of deep layer, which is the extensor pollicis brevis muscle. Okay, so this muscle has got its origin from the posterior surface of shaft of radius and the adjacent interosseous membrane of forearm, as you can see. And then after origin, the muscle fibers of this muscle spiral laterally over the distal radius to form a muscle tendon. And that muscle tendon then crosses the wrist joint to enter the hand. And in the hand, this tendon runs inferiorly to insert onto the posterior aspect of base of proximal phalanx of thumb, as you can see. So the action of this muscle is quite easy to memorize from the name of this muscle, the extensor pollicis brevis. So the word extensor simply means that this muscle is an extensor, and the word pollicis is for the thumb. So simply this muscle extends the thumb at the metacarpophalangeal joint. So now moving further medially towards the fourth muscle of deep layer, which is the extensor pollicis longus muscle. So the extensor pollicis longus muscle has got its origin from the posterior surface of shaft of ulna and the adjacent interosseous membrane of forearm. And then after origin, the muscle fibers of this muscle run down inferiorly over the posterior aspect of forearm and form a muscle tendon at the distal forearm. And that muscle tendon crosses the wrist joint. And after crossing the wrist joint, this muscle tendon runs inferiorly over the posterior aspect of the thumb and inserts onto the posterior aspect of base of distal phalanx of thumb, as you can see. So the difference between the insertion of the extensor pollicis brevis and that of the extensor pollicis longus is that the extensor pollicis brevis inserts onto the proximal phalanx of the thumb, while the extensor pollicis longus inserts onto the distal phalanx of thumb. So the extensor pollicis longus has the word longus, so it gives a hint that it would insert onto the distal phalanx of thumb. Now, if we talk about the actions of this muscle, so the extensor pollicis longus has got the same action as that of the extensor pollicis brevis, which is the thumb extension. But the difference between the action of these two muscles is that the extensor pollicis longus acts on the interphalangeal joint of the thumb, while the extensor pollicis brevis acts on the metacarpophalangeal joint of the thumb. So the extensor pollicis longus acts on the interphalangeal joint of the thumb to extend the thumb. Okay, so now moving further medial towards the fifth and last muscle of the deep layer of posterior forearm, which is the extensor indicis muscle. Okay, so this muscle has got its origin from the posterior surface of shaft of ulna and the adjacent interosseous membrane of forearm. And after origin, the muscle fibers of this muscle run straight down inferiorly over the posterior aspect of forearm and form a muscle tendon at the distal forearm, which crosses the wrist joint to enter the hand. And in the hand, this tendon runs inferiorly to insert onto the extensor expansion of index finger, as you can see. So this muscle has got a simple action, which is the extension of the index finger at the metacarpophalangeal and interphalangeal joints of the index finger. Okay, so with that we have covered the origins, insertions and actions of posterior muscles of forearm. So now we will move towards the nerve supply of posterior compartment of forearm. So as we discussed in the beginning of our tutorial that all of the muscles of posterior forearm except the anconeus muscle have got the same nerve supply. So that means all of the four muscles of superficial layer except the anconeus muscle and all of the five muscles of deep layer have got their nerve supply from the deep branch of radial nerve. And if we talk about the nerve supply of anconeus muscle, so the anconeus muscle is supplied by the radial nerve through a muscular branch. So the anconeus muscle has got its nerve supply directly through a muscular branch of the radial nerve to the anconeus muscle. So let me show you these nerve branches. Okay, so that's the radial nerve which gives off nerve branches to supply the muscles of posterior compartment of forearm. So the radial nerve gives off two nerve branches. The first nerve branch is this nerve, which is the deep branch of radial nerve, and it supplies all of the muscles of posterior forearm except the anconeus muscle. And the second nerve branch given off by the radial nerve is this nerve, which is the muscular branch of the radial nerve to the anconeus muscle. So this nerve branch is supplying the anconeus muscle and it arises of the radial nerve just in the middle of arm, as you can see. And if we talk a little about the origin of the radial nerve, so the radial nerve has got its origin from the posterior cord of the brachial plexus. Okay, so that covers our discussion of the nerve supply of the posterior compartment of forearm. And now we will talk about the blood supply of posterior muscles of forearm. So, the brachial artery traverses the arm and on entering the cubital fossa, it divides into two arterial branches. So, this arterial branch, which is the lateral branch of brachial artery, is called the radial artery. And this arterial branch, which is the medial branch of brachial artery, is called the ulnar artery. And then these arterial branches, that is the radial and the ulnar arteries, give off further branches which then supply the muscles of posterior forearm. So let me show you those arterial branches. Okay, so let's start with the branches of the ulnar artery. So this arterial branch is called the common interosseous artery, which comes off the ulnar artery, and the common interosseous artery then gives off two more further arterial branches, which are the anterior interosseous artery and the posterior interosseous artery. So as this is an anterior view of forearm, so this artery is the anterior interosseous artery. And in order to show you the posterior interosseous artery, I will turn the model so that you can see the posterior view of forearm. So let me show you the posterior interosseous artery. So now you are seeing a posterior view of forearm, and this arterial branch is the posterior interosseous artery, which comes off the common interosseous artery, and it is a second branch of the common interosseous artery. So these were the branches of the ulnar artery supplying the posterior muscles of forearm, and now I will show you the branches of radial artery which supply the posterior muscles of forearm. So I have turned the model back towards the anterior view of forearm, so you can see the branches of radial artery which supply the posterior muscles of forearm. So this arterial branch, which is the radial recurrent artery, arises directly from the radial artery, and it also supplies the muscles of posterior compartment of forearm. So these three arterial branches, that is the anterior interosseous artery, the posterior interosseous artery, and the radial recurrent artery, are the arterial branches which supply the posterior muscles of forearm. And then these arterial branches anastomose above with the branches of the brachial artery to form a complex network of anastomosis around the elbow joint. So with that, our discussion of the posterior compartment of forearm comes to an end. So if you have any confusion in what we studied, you can ask me in the comment section. Thank you so much.